Hi, and welcome to Sip of Wellness, a podcast where we talk about anything and everything related to healthcare and wellness, with some of the high end experts in the field here. Today, we would like to talk about something that is so important for many, uterine fibroids. But before that, I would like to introduce to you to our guest, Dr. Christelle Abboud, who's a French gynecologist and obstetrician, as well as breast surgeon with an experience in laparoscopic surgeries and diagnosing endometriosis, treating uterine fibroids, as well as genital prolapse. Dr. Abboud, thank you very much for joining us today.
Hi, good evening, Dalia. How are
Good
you today?
evening. I'm good, thank you. So would you just give us a little bit about your background?
Well, I'm a French and Lebanese OB-GYN. I did part of my studies in Lebanon, and then I finished in France. I did a lot of work in advanced laparoscopies. So I do high-level laparoscopies treating uterine pathologies, like you said, endometriosis. And we do as well a lot of genital prolapse. We do ovarian diseases, malignant pathologies as well. And I do a bit of breast. Being a French surgeon, we do a lot of breast surgeries as well.
Mm-hmm. So, doctor, would you just give us a little brief about what uterine fibroids are?
Well, uterine fibroids is, first of all, it's a benign disease. It's benign tumors. This means it's a non-cancerous tumor that grow on the muscle of the uterus. It's extremely frequent, like around 50% of women will have a fibroid in their lifetime. But not everybody is to treat. So fibroid will be, depending on their localization on the uterus, they will give different symptoms. And depending on the symptoms, this is when we choose to treat or not to treat the patient. There is different localization for the fibroid, and depending on their localization, we have there is a classification. But to make it short, I'm not going to go through very medical classifications, but to make it short, you have the submucosal one that are close to the endometrial lining that will cause the bleeding, the pain, the cramping, blood clots. There is the one that we call intramural. It's in the middle of the muscle of the uterus. And they need to grow to a certain size, sometimes, mostly of the time, above 4 centimeters to start causing symptoms. It could be heavy bleeding, affecting the fertility. Same as submucosal, of course, that may affect the fertility as well. And when you have a subserosal one, which are the fibroids that are growing outside the uterus, outside the muscle, they need to grow quite big and start compressing the organs to cause the different symptoms, which is compression of the rectum, the bladder, the nerve, or just being very heavy on the uterus and causing the chronic pelvic pain.
Mm-hmm. So, doctor, usually they consider this as an old age disease. Do you think that is a myth or a fact?
It's a myth because, well, it's a disease that is affected, and the tumor grow with the hormones, estrogen and progesterone, that are usually secreted in a childbearing age. So usually it's a disease for women between 20 and, let's say, 45, 50 years old.
Mm-hmm. So in this case, like, since the diagnosis is early, I mean, like, because it happens really early, do you think women are aware of it at an early stage, or it takes like a long time till they find out that they have fibrosis?
Well, only 30% of fibroid will cause symptoms. So many women do have fibroids without even knowing it. So either it's diagnosed through an ultrasound, she's on with her gynae doing her checkup, and they can see some small fibroids, or sometimes even big fibroids not causing any symptoms. Talking big, I'm talking about 7, 8, 9 centimeters, sometimes with no symptoms. So these are fibroids not to really do surgery or treat, as they are not causing symptoms. But some go seek some help because they are having very heavy period, because they have a fibroid that's located close to the inner lining of the uterus, so it will cause very heavy period, painful period, cramping, sometimes even infertility. Some may have other types of symptoms like back pain. They could have compression of the organs depending on the localization of the fibroid. Let's say there's fibroid growing on the anterior part of the uterus, it will compress the bladder. So they will feel that they need to go to the pee room very frequently. They are not able to hold the urine for a long period of time.
Yes.
They can have compression of the bowels, so they may have a lot of feeling gases or constipation. They could feel pressure, rectal pressure. So we can have sometimes compression of certain nerves. They can even have symptoms as sciatica. So they may come to see for symptoms without knowing that it's a fibroid. And with the proper imaging, we can give her the diagnosis, and with the diagnosis, the treatment.
So, doctor, does the size really matter in the symptoms that we get?
Of course, size do matter.
Yes.
But again, depending on the localization of the fibroid. Let's say we have a fibroid that's very close to the inner lining of the uterus. Even if it's quite small, it can cause very heavy periods. So the symptoms could be quite important. We'll have a lot of blood clots. The woman will lose iron and will lose points of hemoglobin. So she'll develop anemia. Anemia will come with fatigue, will come with sometimes depression, palpitations, pallor. So even a small fibroid in the localization, as what we call the submucosal, will cause important symptoms. But if the fibroids are deeper in the inner muscle, they will cause different symptoms. So this is when they have space to grow. So they may be they need to reach a bigger size to start causing any problems.
So based on that, then we could manage accordingly, or is it like, would we go for surgery options?
Yes. Well, the treatment of fibroid, there's different types of treatment, obviously. With time, studies, they try to go for more medical treatment. But unfortunately, some treatment have a lot of side effects. So there was a medical treatment that was modulating the receptor of the progesterone. It was called Esmia. It was quite efficient in treating the symptoms, but unfortunately it did cause some severe hepatitis. So it has been removed from the market, which removed one option of medical treatment for us. There was other medical treatment injectables that would put just the ovaries to sleep. When you put the ovaries to sleep, like chemical menopause, you reduce the hormones, less hormones.
They start shrinking, right?
They start shrinking, exactly. They shrink, they cause less symptoms. But this is not sustainable. We cannot put a young woman, 20, 30 or 40 years old, into menopause without causing problems linked to the menopause and the lack of hormones. Even though we can add some what we'd call a backup therapy with a little bit of estrogen, it's not a sustainable solution on the long run for young ladies. So there have been other types of treatment that we could offer, where we could work on the vascularization of the fibroids. It's called what we call uterine embolization. This is where the radiologist will, it's a technique that would...
dye.
It's that they insert like a small it's micro balls that will just close the uterine arteries. So it will block the blood flow to the uterus. And with the less of blood flow, the fibroid will shrink. These techniques are good, but by blocking the blood flow to the uterus, we may affect as well the function, the fertility of the woman. So this is not a good option for women seeking fertility, especially for women who never had any kids. This is why surgery could be a very good option. For the boy fibroid that we were talking about, a small fibroid close to the inner lining of the uterus, severe bleeding, severe pain, severe symptoms, the treatment could be on a ambulatory surgery called a hysteroscopy, where with a small camera we go inside the uterus through the natural orifices, and we remove the fibroid, and the patient can be discharged at home on the same day. For bigger fibroid, depending on the location of the fibroids, we can offer the different surgical options.
So, doctor, in terms of fertility, are there chances that they could get pregnant having fibroids in the uterus?
Yes, you can get pregnant with a fibroid. But again, size do matter and localization. A fibroid that is affecting the endometrial cavity where the baby will implant will or may affect the fertility. Either the implantation is made very difficult by this fibroid, or it may cause recurrent miscarriages. Sometimes even fibroid that's a bit deeper in the muscle. This is what we call intramural fibroid. With a size bigger than 4 centimeters, they may as well affect the implantation. Even without deforming the cavity, they may affect the implantation of the baby by changing the blood flow to the endometrium, and by causing some hyperplastic endometrium, they may affect the implantation of the baby. So these are fibroids to be treated, and mostly surgery will treat these fibroids just to respect the fertility.
In terms of surgery, I've read an article which said that usually like large fibroids, they are usually treated to shrink it and then proceed with surgery. Could you just like give us a little brief about how that happens?
Sure. So this is why we can combine medical and surgical treatment altogether. So the treatment with the injection I was talking about, this is called the GnRH agonists. It's really putting the woman into a chemical menopause. We can give it for the woman for 3 months. Effectively, it will help for the fibroid to shrink. This will help us as well to increase back her hemoglobin if she had very severe bleeding because of her fibroid. It will allow us to treat her anemia, make her hemoglobin go back up so she can be in a better shape for her surgery. But this treatment makes the dissection of the fibroid more difficult during the procedure. So this is why we need to really see the pros and cons of giving this treatment. And if the fibroids are operable immediately, maybe sometimes we may prefer going for the surgery without giving the agonists. Other option is doing for the embolization at the same time as the surgery. If it's a very big fibroid, by reducing the vascularization of the uterus, we would reduce the risk of heavy bleeding during the procedure, because surgery is what we call the myomectomy. The surgery for the fibroid could be sometimes a bit of hemorrhagic surgery.
Yes, and it could be actually quite a big surgery, I believe.
You may have some bleeding.
Yeah.
So the embolization, or sometimes during the surgery, we can even clip the uterine momentarily. For just during the surgery, we clip the uterine artery just to reduce the blood flow to the uterus. It will reduce the chances of bleeding. So, and after finishing the surgery, we remove the clips. For the embolization, if we do it preoperatively as well, it will help to reduce the bleeding. But we don't do it systematically for everybody.
True. And usually hysterectomy is like the last option in case they are not considering having children.
Hysterectomy is like the definitive treatment of fibroids. Having a uterus with multiple fibroids, we can do the myomectomy, but of course there's always chance of having new fibroids developing later on. For someone who had all her children, she doesn't want to get pregnant anymore, and we can offer a more definitive solution by removing the whole uterus. And usually we can keep the ovaries, so she won't be she don't develop menopause. So the hormones will still be there, but she will not have any more symptom linked to her fibroids. This means no more bleeding or compression symptoms. We can offer it depending of age, number of children, and
of course, like we need to think about all those factors before going into this, because as you said, it's a big decision as well for the lady to consider this as well. Doctor, in terms of let's say, are there any lifestyle modifications where women could do to avoid getting fibroids?
There is certain food that could help us to reduce the size of the fibroid. It's not the miracle solution, but it will help to reduce the growth or reduce the appearance of the fibroid. We need to reduce all the fatty dairies, reduce the fatty meat, like the red meat, processed meat. Seeds are very good. They help. Leafy vegetables, green vegetables, they are very rich in fiber. The fiber helps to eliminate the toxins and reduces a bit the estrogen from your body, so it will reduce as well the stimulation on the fiber from the hormones. Pineapple is an antioxidant.
Wow, that's nice.
An anti-inflammatory as well. It helps to reduce the symptoms by reducing the inflammation.
Yeah. In general, they say that anything that is citrus or has vitamin C helps in...
Because it's an antioxidant.
Yes,
exactly.
antioxidants, yeah.
What else do we have?
But what about vitamin D?
Vitamin D, the sunshine vitamin as well. Well, there is a new medication that is a mix of vitamin D, vitamin B6, and another molecule that will help as well to alleviate the symptoms. So it is part of the treatment. So it's important to keep a vitamin D within normal range, usually above 30 nanograms per ml.
True. That's something that we need to keep in mind because, especially in this region, I believe most of us are vitamin D deficient. So.
Well, the weather is too hot, so you don't want to stay outside, so you don't expose yourself so much.
Yes, that's true. And I think also within the region, maybe this is a question I should be asking, uterine fibroids in this region specifically, is it a high prevalence rate or do you think it's...
Well, ethnicity do play a role. Well, the African American women are actually have the higher genetic risk of developing the fibroids. A higher risk in number and in size. Usually it's multiple and quite big fibroids. But again, 50% of women will develop fibroids.
Is there any specific reason to why specific ethnicity they have this?
It's a genetic
reason.
And this is why we have some families. If your mom have a fibroid, your sister have a fibroid,
there's a chance that
you may have or develop fibroid later on. Age, like we said, you need to be on a childbearing age. So this is why your hormones are stimulating the growth of this matters. So basically, obesity as well. We are now a lot of eating processed food, junk food, and so on. So with the excess of fat, you have an excess of estrogen, and this is what excess chance of developing the fibroids. So please do exercise, pay attention to what you eat, stay fit. This will help as well in reducing the...
Does diabetes have a chance on increasing the risk of fibroids?
No, it's more being the fat where the estrogen will be developed.
True. So, doctor, for those who actually suffer from fibroids and the symptoms, of course it would be having a lot of effect on their mental well-being. How could we focus on that aspect?
Well, the fibroids that are causing a lot of bleeding, so with the anemia, we know that it may develop with the excess of fatigue. Some depression may develop. So this is why it's important to treat the anemia and treat the iron deficiency. By compression of the organs as well, or the chronic pain that may cause, because, well, a big fibroid, if you have a fibroid of 8, 9, 10 centimeter, it's causing a lot. It's heavy on your uterus, so it's heavy on your organs. So you're going to have a chronic pelvic pain, and this may develop into depression. So if there is any abnormal symptoms, go seek the help of your doctor. It could be your GP who will orient you toward the gynecologist, or you go see your gynecologist to see. Mostly symptoms are, again, the most frequent is the heavy bleeding, the heaviness, the pelvic pain, chronic constipation, bladder compression, and sometimes just when you are not able to get pregnant, and this is where fibroid can be diagnosed if you don't have any other symptoms.
Yeah. So, doctor, even there are certain situations where the patient would be having these symptoms, but ultrasound wouldn't show anything that could be fibroid. Is there chances that it could be something else that they would be facing because with the symptoms?
Sure. Ultrasound is a very, very, very powerful tool for gynecologists. It shows us a lot. It's very good for uterus and ovaries. So if you don't see a fibroid on the ultrasound, this means that most probably you don't have a fibroid. But sometimes ultrasound may miss endometriosis, especially at the very early stages. And some deep endometriosis need a good gynecologist or good radiologist to be able to properly see some lesion. You may have the help of the MRI to help us to seek other diseases, and we always need to pay attention to endometriosis that may cause heavy period, severe pain, chronic pelvic pain, or sometimes just infertility without any other symptoms.
Are there any medical advances or researches that are going on right now to make the treatment even easier?
Well, we talked about medical treatment,
Yeah,
but
so
we go
basically-
back to mostly to surgical,
Surgical
because they do
aspects.
have some side effect. There is a certain technique that we do. There is uterine embolization that the radiologists do, but there is other technique where they do something called a high intensity focused ultrasound. But there is some indication and some possible complication. Basically, they're gonna just with the ultrasound burn the fibroid, and so we can have some skin burns. If there is any bowels close to the fibroid, sometimes you can have some bowel lesion. You cannot do it for very big fibroids. So with the different techniques, but there is some restraints, so surgery would still be one of the best options for symptomatic fibroids. Again, we don't treat any fibroid. It's just if we see a small fibroid, we don't need to jump to surgery or any treatment if the patient has zero symptoms.
Doctor, moving from all this on the side, how about you share with us a story that you had of a patient with let's say a success story that you had with a patient?
Success story. Well, I had this pregnant lady. She was I saw her. She was pregnant. She had a small fibroid at the beginning of the pregnancy. The bigger her baby became, the bigger her fibroid was as well. So the fibroid grew up to 13 centimeters to the end of her pregnancy. Everything went well. She was able to deliver, but the fibroid didn't shrink after her pregnancy. So 3 weeks or 1 month after her delivery, she was still having very severe pains, very severe bleeding. So we had to do the myomectomy, and we were able to do it by laparoscopy and remove a 1 kilo fibroid.
That's actually, it's quite a success to have a pregnancy with also a 13 kilo of, centimeter
it's a 13
of fibroid.
centimeter,
Yes,
but
13
one
centimeter
whole
almost.
kilo of fibroid.
1 kilo, yeah. So it's quite a huge thing. Imagine a baby and this, it's like carrying two.
She has
two,
her watermelon close to her baby.
Yes. But that's quite an interesting one. Thank you for sharing it with us. So, doctor, in terms of pregnancy, you shared with us your success story, but what are the chances that pregnancy can be normal with fibroids, or chances of getting pregnant with fibroids as well?
For the fibroids that are far away from the cavity, they would not affect the ability of the woman to get pregnant, so she can get pregnant. But with the effect of the hormones during pregnancy, these fibroids may grow quite large. So they may cause different symptoms. Sometimes they are growing too fast, so the blood supply to the fibroid is not developing as fast as the fibroids, so they just die. They do what we call a necrosis, and this may cause a lot of pain. It could be quite painful for the lady. And it may, the fibroid may as well induce some early contractions because, they are affecting the muscle of the uterus. So this is what we call a preterm labor that we need to deal with. And sometimes we need to just treat the preterm labors with medication, put the woman in bed, and it could be quite a difficult pregnancy. The other effect is having miscarriages if the fibroid is deforming the inner lining. The embryo cannot implant properly, so the woman will have recurrent miscarriages or even not get pregnant.
So, doctor, we spoke about all these. What about in terms when someone is diagnosed with fibroids? We know that with age it might grow bigger because of the hormone, but is there a possibility that it would shrink and disappear? When
you no more hormones, Well, no more
more.
stimulation. So this is where we hit the menopause. When a woman do get into menopause, the fibroid will shrink. This is why if a woman is diagnosed at 50, 51-year-old, we can go towards medical treatment and push her into menopause and say that with menopause, a fibroid will shrink. The only concern would be if the fibroid is fast growing at a more advanced age, and even for young ones, but mostly at a more advanced age, and it's a fast growing fibroid, we are always afraid of having some cancerous tumor mimicking the fibroid. This is what we call the leiomyosarcoma. This is where not only the ultrasound, but the MRI will help us as well in differentiate. And if it is quite suspicious, this will affect the way of doing the surgery. And for a sarcoma, it's always better to go for an open surgery.
What are the chances that these fibroids or these tumors could turn to be something like sarcoma?
The fibroid is benign, but when we have, especially it's only when it's a unique mass and it's very fast growing and advanced age, we may have a high index of suspicion that it is a sarcoma to start with. Sometimes we may have some small foci of sarcoma. Pathologists in many studies, we can say, okay, there is a small foci of cancerous tumor, but it's like 1/300 cases, and it's not very, very frequent.
This would be done after pathology, right?
Yeah.
Which means you do biopsy for
We
it,
don't do
or
biopsy
no
for a fibroid.
Okay.
Where do you biopsy?
Yeah,
on
true.
this site, on this site, on this site. But when you have a high suspicion of being a cancerous tumor, either on the ultrasound or the MRI, this is why we should not hesitate to treat it as a cancerous tumor.
Doctor, one advice for patients on how to advocate themselves when they see their doctors about their symptoms.
It's not the patient who need to come and say, oh, do I have a fibroid or not? At the end, the patient has symptoms and she's seeking the help of her doctor. But this is when the doctor should just explain what is the fibroid. It's important to know that the fibroid is frequent. It's not cancerous. It may grow very big, and but for small asymptomatic fibroids, we should not treat. And depending on the different localization of the fibroid, we need to choose the exact procedure to do. Either go for a hysteroscopy for all the fibroids that are accessible through the uterine cavity from the genitals, we can access them. And we do for laparoscopy till a certain size of fibroid. When sometimes the fibroids are too high, sometimes we need to open
do open surgery.
To do open surgery. Let's not forget the robotics, robotic surgery, but everything that can be done by robotic can be done by laparoscopy for the fibroids. So laparoscopy is quite a good technique as well.
And it comes up with less complications after surgery, right?
The laparoscopy,
yes.
Sure, there is less of pain. There is quite smaller scars. There is less risk of blood clots after the procedure. The recovery is quite faster.
Infections would be also less.
Well, smaller. If you have smaller incision, definitely less infections as well.
Yes, definitely. Thank you so much, Dr. Abboud, for joining us on this episode. Just if you let us know, the listeners, if they would like to visit you or come consult you, where can they find you?
Well, I do practice on 3 sites. I'm in HealthBay Women's Care Clinic, and I'm in King's College Hospital in the Marina branch, and I do as well a consultation and surgeries in Zahra Hospital. But if anyone wants to contact me, either they can just pick up the phone, take an appointment, or they can send me an email. I'm sure we will give you my email. It's drchristelleabboud@gmail.com, and I'll be happy to help.
Thank you so much for joining us. Dear listeners, we hope that you enjoyed our episode today and the topic that we spoke. And as Dr. Abboud has mentioned, you can visit her in Zahra Hospital, in HealthBay, and if I didn't miss,
King's College
King's
Hospital.
College Hospital. Make sure to like and subscribe and hit the notification button on YouTube to get notified every time that we put on an episode, as well as stay tuned every Friday because that's when we do it. And we're looking forward to seeing you next episode. Thank you.